Please introduce yourself to the jury.
My name is Donald Pruitt. I'm an orthopedic hand surgeon currently working for Mercy Clinic Orthopedics.
Thank you, doctor. And are you one of the treating doctors, in this case, that treated Jeff Crowley for the injuries he suffered in a motor vehicle crash? Yeah. And doctor, we met briefly, but again, my name is Brent Sumner, and I represent Mr. Crowley in regard to the injuries he suffered in this case. I'd like to review your background, if we can, for the jury, just so they understand how you became involved in this case and a little bit about you. I'm going to show you what we have marked as Plaintiff's Exhibit 7, which is a copy of your CV. Is that correct?
Yes, sir.
And you stated earlier that you are an orthopedic surgeon. Is that right?
Yes.
And what is your specialty, sir?
I specialize in surgery of the hand.
Okay. And did you perform surgery on Jeff Crowley for the injuries he sustained in this crash related to his elbow?
Yes, I did.
Okay. And I show, just briefly, we'll go over your CV for the jury. I show you graduated from medical school in 1983, is that correct?
Yes.
And I show that you received your medical degree in 1983, is that correct?
Yes, sir.
All right. And then you did your residency at Washington University and through Barnes Jewish Hospital, is that right?
Yes.
Tell us about your residency, if you would.
My first year in 1983 to 1984 was a general surgery internship. We rotated through some of the general surgery programs. And then I spent a 4-year program at Washington University learning orthopedic surgery, and then 1 more year specializing or subspecializing in surgery of the hand with Dr. Paul Mansky.
And Dr. Paul Mansky is considered a world-renowned hand surgeon, is that correct?
Yes, sir.
And so besides the 4 years of orthopedic surgery, you did an additional year specializing in the hand, is that right?
Yeah, hand and upper extremity.
Okay.
That's what we did.
And when we talk about upper extremity, we're talking about basically anything from the shoulder to the end of the hand, is that where
Well,
we
with
are?
Dr. Mansky, it was up to about the elbow,
Okay.
and he did very little shoulder.
Okay. And then after that, you stayed on at Washington University for a period of time, correct?
Correct. I was a junior faculty member.
Okay. And doctor, I show you are board certified in orthopedic surgery. Will you tell the jury what that means?
Board certification is the certification that you know about your orthopedics. What we do is they review a number of cases you do, then you take some exams, both written and oral, and then every 10 years one needs to recertify in that. I also did some subspecialty certification in surgery of the hand and have recertified in that as well.
And so, doctor, is 100% of your practice today focused on hand surgery?
Hand and upper extremity,
Okay.
not above the shoulder, and I'd say that's 95 to 100% of it.
Okay. And doctor, we're here regarding your patient, Jeffrey Crowley, and he was involved in a motor vehicle crash on July 5th, 2016. Is that your understanding?
Yes, sir.
Okay, and we marked as Plaintiff's Exhibit 8 the total access urgent care records from the date of the crash. And if you would, doctor, please tell us about the presentment there on page 2 at Total Access Urgent Care of Mr. Crowley.
These were records indicating the patient had come in that day for a motor vehicle accident. It had been 3 hours before they had seen him. Reported being in a collision. Says with a driver who ran a red light 3 hours prior to the visit. Was reporting pain in his left forearm, denying numbness and tingling at that time.
And did they do x-rays of Mr. Crowley's neck and forearm at the urgent care facility on the day of the crash?
Yes, I see records of x-ray cervical spine and x-ray of the forearm.
Okay. And doctor, I'm now going to hand you what we have marked as Exhibit 9, which is the emergency department records from Missouri Baptist. Is that correct?
Yes.
Okay. And we show that Mr. Crowley reported to Missouri Baptist ER 3 days after the crash. If you would tell us the date of that treatment.
It says July 8th, 2016, 12:02.
Okay, and there on page 2, in the highlight section, it talks about the comprehensive assessment, if you will, or HPI there, it's highlighted, for Mr. Crowley. If you would, please tell the jury about the assessment.
It states wound number 1 was bruising along the left forearm. And then the second thing, they talk about pain assessment, aching, general location head, radiating to the neck, specifically posterior, began suddenly 3 days earlier. Said he'd had pain treatment with pain medication and a muscle relaxant with some effectiveness.
Okay. And did the doctors at Missouri Baptist order a CT of Mr. Crowley's head because of the concussion symptoms?
Yes, they did. CT head, CT cervical spine.
Okay. And it's in the records, but I pulled the CT of the cervical spine. If you would, doctor, what did the CT of the cervical spine show for Mr. Crowley?
Indicates that the cervical alignment demonstrated loss of lordosis with some straightening, no fractures or posterior element widening seen.
And doctor, the loss of cervical lordosis just means that the normal curvature of the neck is out of line due to muscle spasms or things like that, correct?
Typically, it's an indication of muscle spasm.
Okay. And that is something that typically is caused by a car wreck, correct?
It can be caused by many different things, and that would be one potential cause.
Okay.
It's the same thing.
And if you would, doctor, in Exhibit 9, flip to page 6 for me.
Okay.
And if you would, what was the final diagnosis given related to Mr. Crowley and his injuries there at Missouri Baptist?
Diagnosis was a post-concussion syndrome and then acute strain of the neck muscles.
And what was the final note by Dr. Joseph Galkowski there regarding Mr. Crowley?
Okay, he had reported persistent neck pain, lower back pain, pressure behind his eyes, and intermittent visual changes. On exam, he has mild tenderness and bilateral paraspinal musculature, right greater than left. No significant bony tenderness and no step-off noted. He had declined plain films of the lumbar spine at that time, did have some mild diffuse tenderness in the midline and bilateral lumbar paraspinal musculature.
Thank you, doctor. And we show after Missouri Baptist, Mr. Crowley was seen by his primary care doctor, a Dr. Robert Perez, and we've marked Dr. Perez's records as Plaintiff's Exhibit 10. Is that your understanding of his course of treatment as well, doctor?
I know that he had seen Dr. Perez before I saw him because in my notes indicate he came from Dr. Roberto Perez, who I've known for many years.
Okay. And we show that his first follow-up visit with Dr. Perez was on 7/25/2016. Is that what you show there in front of you, doctor?
Yes, sir.
Okay. And at the time of that visit, what was Jeff still reporting to his primary care doctor?
He had persisted 2-week follow-up to a concussion sustained with a motor vehicle accident 20 days ago. States his peripheral vision disturbances have resolved, still having some intermittent headaches every few days.
And was he also reporting lower back pain and neck pain at this visit on 7/25/2016?
He puts that down in his review of systems, yes, positive for lower back pain and right neck pain radiating to the right arm.
Okay. And what did Dr. Perez suggest for Mr. Crowley?
He suggested referral to physical therapy.
And is that a reasonable and necessary course of treatment when a patient's reporting neck and back pain?
Yes, that's typically what we do.
Okay. And so we marked as Exhibit 11 the SSM physical therapy records, which are quite voluminous. And I'm just going to show you, doctor, and I made it easy, this is the initial visit. What is that date of the initial visit at physical therapy?
August 5th, 2016.
And if you would, just for the jury, when he reported to physical therapy, what were they seeing and treating him for on that August 5th, 2016 visit?
The diagnoses listed were on the spine, lower back pain, general medical. They listed concussion without loss of consciousness, subsequent encounter, and in the spine it said cervicalgia.
And cervicalgia is a fancy term for neck pain, correct?
Yes.
Okay. And he had quite a bit of physical therapy. We're not going to go through all of that. But Mr. Crowley was eventually seen by you at your office, which is Mercy Clinic Orthopedics, correct?
Correct.
And you provided us with your records, which we have marked as Plaintiff's Exhibit 12.
Yes.
And is that a fair and accurate copy of your medical treatment records for Mr. Crowley?
Yes, this was a copy of what I have here in the chart.
And you can give me those since you have your chart there with you. And what we marked as Exhibit 12, you provided to us and to defense counsel, correct?
Yes, sir.
Okay. So I noticed in your first visit, which was 12/19/2016, you identified the left lateral epicondylitis tear. Did I say that right, doctor?
Yes.
So if you would, explain to the jury, what you identified on your initial visit.
Well, I made note that he had reported pain in his left elbow after a motor vehicle accident on July 5th of this year, and I was seeing him December 19th. He had continued pain, and he'd gone through a session of physical therapy with at least 10 visits over the course of the summer. Reported continued pain primarily on the left lateral epicondylar area, and reports that the physical therapy did not help him all that much.
And if you would, for the jury on the video, show us where you're talking about on the arm.
Okay, it'd be the outside part right here, the area also known as tennis elbow on the elbow, where the extensor muscles that straighten your wrist and hand attach.
Okay. And it was almost a year from your first visit until you did the surgery, is that right?
Yes.
I noticed that's kind of the course of treatment in the medical literature. Will you explain to the jury why you give it so much time before opting for surgery?
Many of these injuries will eventually get better with more conservative treatment rather than going right to surgery. My assessment was I wanted to try some things for him first, such as cortisone injections, prior to working him up for potential surgery.
Okay. And so did you try these cortisone injections in Jeff's elbow before surgery?
Yes, I did.
Okay. Tell us how many of those did Jeff have?
I did 2 of them for him.
Okay. And are these cortisone injections painful?
I do the best I can to numb the area up with a lidocaine shot first, and then I place the injections. There can be some pain with it, but not excessively.
And what is the goal? For people that aren't familiar with cortisone shots, what is the goal with a treatment like that?
It's to settle the irritated tissues around the elbow down. I didn't have an exact diagnosis of what was going on inside at this time, but was assuming it was degeneration of the extensor tendons. And a lot of times the injection will make the pain better so that then they can do the stretching exercises to hopefully eventually get better completely.
And is it fair to say the injections did not work for Jeff since he did not get better?
Well, the first injection worked quite well for quite a few months.
Okay.
And then after the pain returned, I tried a second injection, which did not work as well. And then I ended up working him up for potential surgery.
Okay. And what was the date of the MRI you performed on Jeff's elbow?
Date was October 13th, 2017.
Okay. And did the MRI identify a tear in his elbow?
I identified advanced lateral epicondylitis with a high-grade, they recorded a partial thickness tearing of the extensor tendon attachment.
Okay. And then shortly after that MRI, did you perform surgery on his elbow?
Yeah, I looked over the MRI and thought that it probably wouldn't get better without surgical treatment.
Okay, and what was the date of the surgery you performed?
That was November 1st, 2017.
Okay, and for your surgery, did you put Jeff under general anesthesia?
They had the anesthesia people give him an axillary block or a block to numb the arm. That's mainly for post-operative pain control, and then they did do a general anesthetic while I did the actual surgery.
Okay. Have you known that being put under general anesthesia, can that be a stressful event for some patients, a source of anxiety?
For some patients, it can generate extra anxiety, yes.
Okay. And what are the general risks of being put under using general anesthesia?
Well, there's a variety of different risks, including adverse reactions to the medications, difficulty waking up from it, sometimes some post-operative lung issues.
Okay. And you said you used a block. Can you tell the jury what that means? What's a post-op block?
Well, this was done preoperatively, and what they'll do is inject some medicine up near the shoulder to anesthetize the nerves going down into the arm. What the advantage of this is it does help them out considerably with post-operative pain, but it also gets rid of a lot of the intraoperative pain for the patients, and they can run them on a much lighter dose of general anesthesia. So that's why we do it typically beforehand.
And this, I assume, can be a painful surgery and a painful recovery for patients. Is that fair to say?
It varies from patient to patient.
Okay. Let me show you what we have marked as Plaintiff's Exhibit 13. And Plaintiff's Exhibit 13 is a demonstrative exhibit, so it's not an exhibit of Mr. Crowley's actual surgery, but it's a demonstrative that helps you show the jury what went on during the procedure. So let me ask you this, is Exhibit 13 kind of a fair and accurate representation of the surgery you performed on Mr. Crowley?
It shows a number of the different things. I didn't use exactly this technique, but pretty close.
Okay, well great. If you would, I'd like you to explain to the jury the surgery you performed, and if we can, maybe, I don't know, is that okay, that phase for you, to where we can show them on the video what happened?
Okay, this is a typical approach to the lateral epicondyle. An incision is usually made either straight or slightly curving. I usually do a slightly curving incision on the outside of the elbow, and the typical is about 2 to 3 inches long, like this. You dissect down underneath. Typically, the more superficial of the two muscles is not involved with this. You make a split through that so that you can open that up to get to the deeper one, which usually is where you're going to find your tear. And down there you can find a variety of different things. Sometimes with overuse type tears, the tendon will be rather degenerated. In this case, and I noted in the operative note, what I found was the muscle and tendon unit that attached to the elbow had pulled off and was in one unit. I did have some degenerative tissue around it, which I removed. I then looked at it and couldn't really get it. I did not use this large biter thing that they show here. And then I did a repair, and what I ended up doing was I couldn't pull this all the way back to the bone without putting it under undue tension. So I attached it to the top tendon that was not as involved with a couple sutures to attach the larger one to that, and then the top tendon I put some sutures between that and the bone to repair that back down to the bone and restabilize the tendon mass. And that's the procedure I did for Mr. Crowley.
And about how long is that procedure, if you will?
Well, from start till when they finish and start heading to recovery room, typically about 90 minutes.
Okay. And how were you able to determine that the crash caused this tear to Mr. Crowley's tendon?
I can't totally determine that, but I can tell you that typically there's 2 ways you can get this tennis elbow problem. One is from overuse, which is most of the patients, and they'll gradually degenerate the tendon and have a mushy type of tendon origin. The second is a traumatic type of injury that can occur, and this one was suspicious for traumatic because the entire mass had pulled off in one piece. And that's what I found in there, as opposed to the ones where the tendon is more degenerated.
And you noted that in your op report that the tendon actually pulled off, correct?
Yes, I did.
And so based upon the crash and the immediate reporting of pain in the left arm and then the bruising 3 days later, taking the totality of the circumstances plus the ECRB tendon being pulled off, it was your medical opinion that the crash did cause this rupture in his tendon, correct?
That's what I think likely happened, yes.
Thank you, doctor. So let me ask you this about some of the long-term issues that you see as a doctor related to an injury like Jeff suffered here. Do you see, long-term residual weakness, things like that? Will you tell us about that?
Overall, I've had fairly good luck with this surgery, and I usually take a bad situation to make it better. I don't think I make it back to 100% what they initially started with. What percent strength somebody recovers varies from patient to patient. So I don't think I can make a blanket statement on that. I can say that it's usually not 100%, but also usually a lot better than what you start with.
Okay. And Jeff has reported some intermittent pain. Is that usual?
Not unusual.
Okay. And what about some loss of range of motion? And I'm not going to say it right, but he has talked about he doesn't have full extension. Is that common?
Again, varies from patient to patient, but not uncommon to lose a little bit, not a lot.
Okay. You always hear, doctor, about with these musculoskeletal injuries, people reporting, that they feel the weather and changes like that after surgery. Can you tell us a little bit about that?
I don't have scientific evidence to say that you can predict the weather after these type of musculoskeletal injuries, but many patients do often note that they can feel the cold or rainy days a little bit more.
All right, and I noticed, doctor, in the medical literature that it says, 80% of people that have had this surgery, experience the same surgery as Jeff, do quite well in their recovery, but there's about 20% that don't do well. Is that fairly accurate as far as the medical literature is concerned?
Yes.
Okay, and so if Jeff would fall in the group of 20%, what is typical in that group that you're seeing based upon your practice?
Ask that again.
Yeah.
So make sure I get
No worries. So if the medical literature is saying that 80% of people that have this surgery Jeff had have no problems and 20% do, is that correct?
Yes.
Okay. And so what I'm asking is, if Jeff falls into that grouping of 20% of patients, what are those problems that people can expect?
Well, you can see it all over the board, from very minimum complaints to significant ones. Generally, it's a little bit of loss of range of motion and strength.
Okay. Are any of these problems indications for future elbow surgery?
It's been very rare.
Okay. So as you sit here today, is the risk of any type of future surgery to the elbow in that 20% group, or is it probably less than 20%?
It'd be significantly less than 20%.
Okay.
Relatively rare to reoperate this problem.
And doctor, everything that we've talked about today, you believe was related to this crash, correct?
I think it's likely the crash was a significant causative factor here.
Okay. And doctor, have all the opinions you've given today been based upon a reasonable degree of medical certainty given your background?
Yes, sir.
I don't have anything further, doctor.
Doctor, this is a record from October 4, 2009. Can you tell me, are you familiar with a record like that?
I've seen similar things at some of the other SSM hospitals.
Okay.
Yeah.
And there's a diagram of the body on that exhibit. Do you see that?
Yes.
And are you familiar with a diagram, an image like that for a patient or a physician to point out where there may be body problems?
Yeah, I've seen these before.
Okay. What is the image, there are two images of a human figure, correct?
Yeah.
There's a left and a right. Or there's a front and a back, right?
Okay,
Of
so
image
this is
of
the
the human.
back here, but then he's got the arm turned.
Right. But there's only one arm that could be on.
Yeah.
When you're facing in the back, which arm is that?
There'll be a left on that one.
Yeah.
Yeah.
So just to be clear, the diagram from October 4, 2009 indicates tenderness in the left elbow for Mr. Crowley, correct?
Yeah.
Okay. Thank you.
Yeah.
And that would have been a complaint that Mr. Crowley had 7 years before the auto accident from 2016, correct?
Correct.